Brace yourselves, because what I'm about to tell you could change your view on non-alcoholic fatty liver disease and the fact that it could happen to you. Your liver has an interesting relationship with fat. So what happens when, instead of allowing fat to flow through the bloodstream naturally, the liver decides to hold on to it, ferreting it away like squirrels holding on to nuts for winter. And when it stores too much fat, it can cause some serious problems. And when it's carrying that amount of fat, that means 5 to 10% of its total weight is fat. Back in the day, this excess fat was associated with drinking too much, but that's no longer the case. Nowadays, it can happen to anyone. You don't have to be a party animal to get a fatty liver, and it's called non-alcoholic fatty liver disease, or NAFLD for short. And guess what? Approximately 1 in 3 people in the US have it. Yep, it's spreading like wildfire. And the sneaky thing about NAFLD is it stays quiet in the beginning, kind of like a ninja in the shadows. You might not even realize you have it until it starts causing some serious issues. Can you believe it? This disorder was almost unheard of 3 decades ago, but now it's one of the most common talked about disorders in Western countries. So what's the story behind all this? Well, it has to do with insulin resistance, which messes with how our body handles sugar. If you want to keep your liver happy and healthy, get in plenty of fiber, be mindful of what you eat, and keep your sugar intake in check. Let's give that liver some love. After all, it's working hard and it deserves a break, don't you think?